as a plastic surgeon, I specialize in the eyelids, tear ducts, cancers around and even behind the eye. So compared to other ophthalmologists, I specialize more along the periocular structures. So with like cataracts or glaucoma or retina, but I deal mostly with the skin side. So that would involve things like double eyelid surgery, droopy eyelids, or eye bags underneath the eyelids, cancers around the eyelids or behind the eye, issues with tearing in the tear duct drainage system, in addition to cosmetic surgeries along the face. So that would be like eyebrows, procedures such as Botox, fillers, fat grafting, in addition to skin rejuvenation procedures as well, like lasers. So I did an ophthalmology residency, 3 or 4 years at Mount Sinai Hospital. And after that, I did a 2-year oculofacial plastic surgery fellowship in Michigan, where we did probably over a couple thousand procedures over the course of these 2 years. With that type of specialty and that type of training, I think it's the specialty, well, the foundation of oculoplastic surgery is kind of unmatched in people with my type of fellowship training. The location that we do surgery is pretty small. It's a small area. However, because it's such a small area, we are very specialized and detail-oriented in a way that most other specialties that would only dabble in our area, we really specialize only specifically in that small area. So we gotten to be pretty advanced at it. So with the upper eyelids, I think there is a preconception that a lot of it is cosmetic, and there's definitely is a cosmetic portion to the upper eyelids. However, as you get older, or even in certain types of congenital, so when you're born, you can have your eyelids either too droopy, or what I see a lot in my practice is that the eyelid creases are uneven, and that gives the impression of droopy eyelids. And it might be one side more so than the other side. So there is a lot of, I guess there's several procedures that can be done to address the, say, unevenness or droopiness of the eyelids. And for each patient, it is different considerations. Sometimes you do it just to lift up the eyelids so that you can see more clearly. Other times you want to create more symmetry between the eyelids, and other times you're looking for a more cosmetic outcome. So for me in my practice, I talk to each patient and I try to address their concerns and how best I can address their concerns. There's several different causes of it. It could be a muscular issue where the muscle lifts up the eyelid is weak. There could be another component where you have just too much skin, and that skin just literally puts weight on the eyelids and drags everything down. So with those type of procedures, there is a definite functional side to it, where you want to be able to give the patient more vision. However, there's the other side where patients have an uneven crease or no crease at all, which can give you the appearance of kind of like a flat eyelid, or no room in the eyelids where for most women would put their makeup on. That is a generally more cosmetic procedure done, where you have to create an artificial crease to either create some symmetry or for an improved cosmetic appearance. So with when you're doing a double eyelid surgery, there's generally 2 different approaches. You have the incisional approach and you have the non-incisional approach. With the incisional approach, you do have to make an incision on the skin and reattach that, at least like the muscle fibers, to the eyelid skin. It's an approach that's it's more permanent, lasts much longer. However, this is a surgery, so you do have that slight risk of of a scar formation, and you're going to be much more swollen, generally at minimum a week, probably closer to 2 to 3 weeks. However, the nice thing, it's a very natural looking double eyelid, and the results are very long lasting. Generally it's permanent. The other approach, the non-incisional approach, what you do is you have to essentially just thread a suture across the eyelid where you want to build your crease. That procedure is also definitely has its benefits. It's a much smaller, much quicker procedure. You do not have to make a incision on the skin, so there's no risk of scar formation. And the downtime, the recovery is much quicker. Generally, I tell patients only a couple of days of swelling. Usually by a week, things are back to normal. However, the results are not permanent. It can last anywhere from 1 year up to maybe 5, 6 years. So with upper eyelid creases, generally, especially in East Asians, the eyelid crease is much lower or sometimes absent in a lot of patients. And the reason is because of the attachment site, essentially the muscle. The muscle does attach onto the skin, and for East Asians, it generally attaches much further down, which is why you get a much lower crease in Asians. But in addition to kind of like a genetic component, I've also seen a lot of post-surgical changes, post-traumatic changes as well. How well that muscle works has a big effect on its attachment site onto the skin. So such as injuries to that muscle can cause the eyelid to not be able to open up as much, which can have an effect on that crease. And prior surgeries, especially on the upper eyelid area, can affect where that muscle attaches onto the skin as well. So I would say in my practice, generally what I see is mostly genetic component, but I definitely have seen a lot of traumatic and post-surgical asymmetry between the eyelid creases. So generally after you do a double eyelid crease formation surgery, it depends on what approach was done first and what issues are wrong with it. As a rule of thumb, I generally like to wait around 3 months prior to any other procedures before we even discuss reoperating on it, mainly because I want to give the body time to fully heal, so I know what the final outcome is before I jump into essentially jump into fix a moving target. So I want to see what the stable eyelid will look like after all the swelling and all the healing is done. However, after that, it kind of depends on what the patient needs. Sometimes for a non-incisional approach, I can jump in and do an incisional approach to fix that pretty quickly, pretty much like immediately after. However, if a second non-incisional procedure wants to be done after a previous non-incisional procedure wants to be done, that you might have to wait a while, several months, if not even a couple of years, before you do another procedure like that. So, I would say generally what I see is younger patients are more amenable to doing the non-incisional approach, mainly because you don't have the incision on the skin, so you don't have that risk of scar. And that oftentimes does mean you need to do more procedures, like more similar procedures in the future, but that lack of risk of a skin incision scar is generally what I notice that most of my younger patients will want to avoid, so gravitate towards the non-incisional approach. However, as you get older, your skin does stretch, in which case the double eyelid surgery, the incisional approach, becomes more sought after, mainly because, at least when I do the incisional approach, I can also remove some additional skin. So essentially you kind of get 2 surgeries in one, where you both remove the extra skin and also create that fold of the eyelid. So most of my older patients will gravitate towards essentially just getting 2 surgeries in one.